Hey, by now you've heard that One Big Beautiful Bill Act contained work requirements for Medicaid. I know everyone is talking about that. In my research today, I encountered some really concerning things that I hadn't necessarily seen before. And so we're going to be going over both those work requirements that are in that big bill that everyone's already talking about, as well as some really almost distressing information coming out about specific states that are pushing those changes really, really fast. So let's dive into what I have for you today. So, sorry, this new system doesn't let me see ahead on my slides. So, gotta wait for this change here. Okay. Yeah. So, like we said, there are work requirements happening under that One Big Beautiful Bill Act. And, when I talked to you guys about this before, I pointed out that the wording of that bill says that those changes have to begin no later than December 31st of 2026. And in all of the news reporting I've seen about this, though, people are saying, oh, they're coming in 2026. That's not necessarily what this says. This says no later than December 31st of 2026. And surprisingly, there are already a lot of states that have submitted proposals on what they want those work requirements to look like, when they want them to go into effect. And there are dramatic differences between each of those state requests that I've seen. We are going to go over them one by one. I can see we've got a lot of people asking in the comments about specific states. We are going to get to that just in a few minutes here. So yeah. First, I want to go over, we talked about this bill in previous videos, so I'm not going to spend a lot of time on this. If you have questions about the changes that are specific to the One Big Beautiful Bill Act, I would encourage you to go check out those other videos that I've done. I did see a report from KFF, which, if you're not familiar with KFF, they are kind of regarded as one of like the big healthcare research firms in America. And they said that this bill is actually the biggest healthcare legislation since the Affordable Care Act, even though it was never framed as a health bill. Functionally, because of the changes that it makes, it's the biggest healthcare legislation since ACA. So it's a very big deal. And I did put a little timeline together. Oh, yeah, sorry, I forgot about this. I don't know if you guys saw this earlier, but it is all over the news that the Agriculture Secretary has suggested that Medicaid recipients could replace immigrants as farm workers. So if you don't think they're serious about these work requirements, this really got my attention today. And I'd love to hear how you feel about this in the comments, because I know when I saw these headlines, anyway, I had some thoughts on that. Now, if you've seen these headlines, I do want to show you really quickly what Brooke Rollins actually said, because I had to do a little bit of research to track down that actual quote. And she was talking about immigration, of course, and she says, there will be no amnesty. The mass deportations will continue, but in a strategic way. And we move the workforce toward automation and 100% American participation, which with 34 million able-bodied on Medicaid, we should be able to do fairly quickly. That shows you how serious they are about this, I think. Now, logistically, if you're concerned about this particular statement, there's all sorts of reasons why it wouldn't really work for Medicaid workers to take on those roles. For example, a lot of people on Medicaid already have jobs. They're not located near farms, so on and so forth. But yeah, like I think this really shows just how serious they are about pushing these work requirements in the Medicaid program. So, like I said, in the One Big Beautiful Bill, there's already a lot of changes. We've talked about these in other videos. I just wanted to kind of show you visually the timeline here. Starting in January of 2026, you're going to have to recertify every 6 months. And then things just snowball with those work requirements going into effect not later than December of 2026. And then the changes just keep going and going and going for the next several years. Now, because we've talked about that previously, I just wanted to kind of show you that on screen really quick as context for what we're going to get into next. Because the changes that I want to talk to you about aren't strictly part of that bill. They're what the states are doing as a result of that. Now, we already know that there's an estimated 12 million people that are going to potentially be losing coverage as a result of these changes. There's all sorts of risks to rural hospitals and so on. Nevertheless, they're pressing forward. Sorry. There's a lot of people I know and love that are going to be affected by these. So this is a really hard topic for me to cover, actually. Now, we know, before we dive in and talk about the state-specific things, it's important to understand what the federal government wants to see in terms of work requirements, because the requirements I saw at the state-specific lists were all very different. So federally, they want to see the states enact changes that require you to work, volunteer, or participate in a work program or a school program, some combination of all those things for at least 80 hours a month. Alternatively, if you make equal to 80 hours of minimum wage, they're willing to count that. So if you make more than minimum wage, you might not need to work all 80 of those hours. And of course, if you're a seasonal worker, they can average your monthly income over the preceding 6 months to see if you're meeting that overall average, because seasonal workers, tend to work more in some seasons than others, obviously. So that's what they want to see at the federal level. And federally, there are a bunch of exemptions in the One Big Beautiful Bill Act too, right? So people under the age of 19, those eligible or enrolled in Medicare, recent inmates, those who meet certain Indian definitions, parents, guardians, caretakers, or family caregivers to children under age 13, or people with disabilities, veterans with 100% disability ratings, those who are medically frail. These are all people who should be exempted from those work requirements. And exceptions are also available for, in a lot of cases, people with drug or alcohol treatment, rehab, pregnant women, postpartum women. Some of the state proposals that I saw, and we'll get into this in a second, but some of them cover, exempt women up to 12 months postpartum. Some didn't go quite that far. And then there are other optional exemptions that they're going to let the state make decisions on regarding whether or not they want those exemptions to apply in their states. So that was all. I think we're past. Are we past that yet? Okay, yeah, here we go. So that was all part of the federal rules. But states, of course, always love to do kind of their own thing. And under the rules of SNAP, there's a lot of, Medicaid, there's a lot of flexibility in how states can interpret and handle these things. And one of the ways that states get that flexibility for Medicaid is through what's called Section 1115 demonstration waivers. And that's just the name of the form that they use to basically ask the federal government for permission to experiment with Medicaid in their state, right? So anything that the state does that isn't typically part of the federal Medicaid rules comes through these waivers. Now, as part of the waivers that I read over today, and of course, if you've been here on the channel a while, I'm not a lawyer, right? I'm just a researcher. I just dig into this stuff full time, but I'm not a lawyer or a social worker or any of that. So do bear that in mind. But some states are asking to not only implement work requirements, but also place lifetime limits on how long you can get Medicaid access. For example, one state is asking for a 5-year lifetime limit. And that would look like, according to what I read, if you had Medicaid coverage as a child, they're not going to count that towards your 5 years. It's only 5 years during your working lifetime. And it said that as part of the waiver, they wouldn't count anything you'd already received against you. So whenever that waiver went into effect, that would be the beginning of the 5-year count for everyone who was covered by that. But again, that's not a lot. Anyway, I don't know if you guys are as concerned about that as I am, but lifetime limits are kind of stressful. There's other states that are, like I said, trying to expedite those work requirements, get them done faster, change the way exemptions work, all sorts of different things. So let's dive in and look at what each state is trying to do. Did it change? I didn't see it change. Sorry, guys. Hopefully this is not a technical issue I'm encountering here. Okay, yeah. So Georgia, we'll start with Georgia because they are the only state that thus far has actually received a waiver to implement these kind of work requirements. And that began with their Pathways to Coverage program that began back in July of 2023. Now, they called this the Pathways to Coverage program. And what it was designed to do was be their Medicaid expansion program. And they put the 80-hour-a-month work limit on it. And they said that you could make up those 80 hours through work or training or education or community service or vocational rehab, lots of different ways that you could get that. And they have been running that program for the last 2 years. However, their waiver for that is going to expire in September. So they are already asking for another 5-year extension on that. And Arizona wants to make a ton of changes. Their waiver request was very long and detailed. So they want to enact work requirements for able-bodied adults between the ages of 19 to 55. And they want you to have to average 20 hours a week. Now, 20 hours a week, 80 hours a month, those sound like the same things. But if they're averaging it, it's a lot, I think, easier to hit those 80-hour-a-month averages than necessarily a 20-hour-a-week average, because if you're getting sick or your child is sick or there's some reason why you're missing work, it's a lot easier to trip up over a week-by-week average than a month-by-month average, which gives you more flexibility to make up lost time. Arizona is also the state that wants to limit lifetime coverage for able-bodied adults to 5 years. The way that I've seen these waivers work in the past, though, it seems like one state asks for something, and then if they are granted that thing, all the other states go, oh, that's a good idea, and then they try to do something similar, which is why I think it's really important for those of you who maybe aren't in Arizona and may not be affected by this. I think it's important that you're aware of what they're proposing, because it doesn't take much for Arizona to get this permission and then have it spiral to other states that want to implement similar limitations. Another thing that they want to do in this state is implement a cost-sharing model for people who use the emergency room or ambulance transportation for non-emergency reasons. So, a lot of times if you don't have, if you have Medicaid, this shouldn't be an issue, but, if you don't have insurance, a lot of times people will go into the emergency room for non-emergency care. And emergency care is expensive. So the state is basically saying if it's not an actual emergency, they want to make people have to pay a portion of that cost. So definitely important to know where any maybe urgent cares are in your area. That's usually a good place to go if you can't get in with your primary care. Urgent care is, a step up from that, but it's not quite as expensive as the ER. Just be aware of that. So, like I said, they want to make this change for able-bodied adults between 19 and 55. And they have a long list of exclusions in their definition of who is able-bodied. So if you're in Arizona and you're concerned about this particular rule, they don't plan on counting pregnant or postpartum women, former foster youth, domestic violence survivors, homeless people, anyone getting SNAP or cash assistance, caregivers, veterans, caregivers, people who are medically frail, and the list goes on and on and on. I could not fit all of their exclusions on this page. And is everyone else able to hear me okay? I just saw a comment saying that there's no sound, and that's concerning to me. If you can hear me, please let me know in the chat. I would really appreciate that. And I will hop in and address the comments in the chat here shortly as well. Sorry about that distraction. Okay, so that wraps up Arizona's waiver request. And again, if you're just tuning in for the first time, we're going over the waiver requests that the states are asking the federal government for permission to make the changes. So these aren't set in stone yet, but we've already seen that the federal government is pushing for work requirements, and these are the states that are asking to make those changes right away. So Arkansas is the next one we're going to talk about. They want to add work requirements to adults ages 19 to 64 who are not enrolled in Medicare or who are not deemed medically frail. Now, one thing I think you'll notice here, each one of the states that we're going to cover kind of just picked their own age limits. One of them goes up to age 62. One of them goes up to age 65. A lot of them go up to age 64. So that's going to vary depending on the state. And I want to also point out here that they're not making this apply to people who are enrolled in Medicare. So if you're a senior, if you're retired, if you're on Social Security disability and you get Medicare, then you would not be affected by this specific proposal. It also says, there's a quote in this big long file that says, service in one's community may be demonstrated in a variety of ways, including caring for a dependent child, an elderly parent, or a person with a disability, which seems to indicate to me that caregivers would also be okay under this provision, because they would count that as community service if you're taking care of, a child, an elderly parent, or someone with a disability. So that's what Arkansas is after. Iowa wants to add work requirements for people between the ages of 19 and 64. And they aren't just asking for 80 hours a month. They want to see 100 hours a month in their waiver request. So they're asking that you either work 100 hours a month, earn equal to 100 hours of the state's minimum wage, or enroll in an educational or a job training program. Another exception to this is if you're already receiving TANF or SNAP. If you are in compliance with those programs' work requirements, then they would not also make you meet the Medicaid work requirements as well. This state is also proposing exemptions for children, seniors, high-risk pregnant women. That was an interesting specification, because most states that exempt pregnant women don't say high risk, but apparently Iowa is going to be kind of nitpicky on that. They also said that they're going to exempt those who are disabled under the Social Security Act, caretakers of children under the age of 6, those who are undergoing substance abuse treatment for up to 6 months, and those with proof of good cause for noncompliance. And there is a whole long list of things that could be counted as good cause there. Okay, sorry. I was just checking to see if you guys could hear me okay in the comments. Okay. Okay, and Ohio has also submitted a request for this. They want to require Medicaid participants to meet at least one of these criteria, 55 years of age. So if you're 55 or older, you're good. They also said employed, but they didn't list any sort of clear hourly requirement on what they would consider employed. So I don't know if Ohio actually has like a mandatory minimum amount of work that you have to be doing. They also said it can count if you're enrolled in school or occupational training, if you're participating in drug or alcohol treatment, or if you have intensive physical health care needs or serious mental illness. Okay. South Carolina. Now, South Carolina's waiver request is specifically for what they call parent caretaker relatives. And I had to look that up because that wasn't a term that I was familiar with. But from what I read, apparently parent caretaker relative is someone who's, related to a child and taking care of them. So yes, so basically parents or caretakers between 19 to 64 years of age would need to meet at least one of these requirements in order to qualify. There's going to be that 80 hours a month of employment, an education program, but they did specify that it doesn't necessarily have to be college. It could be something that's, going to result in a degree, a certificate, or some sort of adult post-secondary education. And again, if you are already enrolled in SNAP, TANF, unemployment, or some sort of substance use disorder treatment, then as long as you're compliant with that program, they won't hold you accountable to their new Medicaid rules once this goes into effect. And then if you're a member of Catawba Nation, there are other ways that you can meet that requirement as well. Okay. And okay. Yeah, Utah also wants to enact work requirements, and I'm sorry that I'm laughing. I shouldn't be laughing. Utah's request is really complicated. It's a lot more convoluted than any of the other ones I read over today, which is why I'm chuckling about it, and I'm trying really hard not to. Okay, so they only want it to apply to adult expansion Medicaid, so people who got Medicaid through the expansion. And if it applies to you, then for 3 consecutive months, you have to register for work, complete a job training evaluation, take any assigned job training modules that they think that you need, and apply with at least 48 potential employers. And then if you do that for 3 consecutive months, then you would remain eligible for the remainder of the 12-month period. So for the next 9 months, you'd be okay. But then you would have to repeat that cycle every single year for 3 months, and then you'd be okay for the remainder of the 12, and then so on and so forth, rinse and repeat indefinitely, it sounds like. which, I mean, I guess there's merit to that now that I'm thinking about it. If you're not able to secure employment, you won't be kicked off because you're not meeting the 80-hour rule like other states have. But it just feels complicated compared to the other explanations that I saw today. Now, of course, Utah does have its own list of exceptions, and there were a lot of them. This doesn't apply to anyone age 60 or older. It doesn't apply to pregnant women or those who are up to 12 months postpartum. If you're physically or mentally unable to sustain employment, then it doesn't count. If you're taking care of a dependent child under age 6, then you're exempt. And there's lots of other exemptions there as well. Now, South Dakota has also submitted a proposal. They want adults to meet one of these. They want you to be employed, enrolled in either job training, voc rehab, or school. You could also be a parent or a caretaker of a dependent child or an elderly or disabled person who lives with you. If you're participating in SNAP, then as long as you're meeting SNAP requirements, then they'll consider you okay. Or if you qualify for an exemption, then of course you don't have to meet those requirements. And their list of exemptions was kind of interesting. It includes not only physical and mental disabilities and pregnant and postpartum women, but also those who live in areas of high unemployment as well. There was some concessions for that too. And I believe their high unemployment determination was made in accordance with the SNAP waiver rules for unemployment as well. Okay. Now, ACSO is an organization that was reporting on a lot of this, and they said, states have also pursued work requirements and other restrictive policies via legislation. So up until this point, we've been talking about states that have actually, submitted those Section 1115 waivers to try to get permission to change their Medicaid rules. The list here, to my understanding, is states that have tried to do this through state legislation instead. So in Idaho, they're pursuing 20 hours a week of work for adults ages 19 to 64 with some exemptions like disability, pregnancy, caregiving, students, that sort of thing. Indiana also wants to see 20 hours a week of work or volunteering with similar exemptions. And then Montana wants 80 hours a month of work or service for adults ages 19 to 62. And they have a long list of exemptions, possibly one of the longest lists that I saw today as far as who won't be affected by that. It included things like foster parents, domestic violence survivors, people who live in high poverty areas, all sorts of different things covered by that Montana legislation. And again, you see some of these say 20 hours a week and some say 80 hours a month. And I wrote down what they specified in their rules. And it seems like there might not be much of a difference between that. But again, it depends on how long they're averaging things out, right? If you have to hit an average of 80 hours a month for 3 months, that's probably an easier benchmark than if you have to hit 20 hours a week and then they only give you, a certain amount of time to hit that average. Because like I said before, getting sick or having, a car accident or, vehicle trouble, there's all sorts of things that can interfere with your ability to get to work consistently day to day. So the more time you have to hit those averages, the more flexibility you have in adjusting your hours. Okay, so those are the states that I saw covered so far. Now, like we've seen all year, these changes are rolling out very rapidly and more things are happening all the time. So I will keep an eye out to see what other states start proposing. Until then, that's the best information that I have as of, this moment right now. But of course, I'll be here to update you as things change. Just one quick thing before we dive into the Q&A here. If you are dual eligible for Medicare and Medicaid, meaning that you can get care from both of those programs, then I would recommend that you reach out to our sponsor chapter. They can help you make sure that you are on the best possible plan, that you're getting the best possible coverage and the best possible benefits from that dual eligibility. And I think if you look at the ticker down below at the bottom of the screen, Chapter also gave us permission to distribute their best-selling book on Medicare for free to our low-income audience as well. And there should be a link coming up in that ticker at some point that shows you how to grab that free book if you're interested in that as well. Okay, so now I'm going to dive into the chat. Okay, so Michael is saying, why are we talking about this for the second week in a row? We know all this stuff. So you may have known about the One Big Beautiful Bill. That's true. The state-specific waivers I have not covered on this channel before, and I haven't seen those reflected in the news coverage over the One Big Beautiful Bill. You know, everyone's talking about the work requirements of that bill, but I'm talking about waivers that they're asking for permission to enact now. So the states that we went over today are probably going to be I don't work for the government or anything, but I would assume that the states that have already asked for permission to enact those work requirements are then going to be the first states that are going to be hit by those work requirements. And since they've already asked for permission to enact those things in this specific way, I think that this information gives a pretty clear idea of what people can expect. And at this channel, we're all about helping people be proactively prepared ahead of time. So, yeah, hopefully that clears that up. As far as state-specific questions, guys, I'm not necessarily going to grab those and answer those here because the slides that we went over covered all of the information that I have about specific states at this time. If anything changes or anything new rolls out, of course, I will jump on here and update you as soon as I find that out. Okay. So Sandy says, I'm 66 and I receive Social Security. I qualify for the QMB program, which is great. Is this going to affect that? I don't think so. If you're on Social Security, you should be, first of all, either over the age limits or considered disabled so that it shouldn't apply to you. That being said, you are a prime candidate to talk to chapter and make sure that you're on the best possible plan. If you are, they'll tell you. If you're not, they might be able to help you get even better results from that coverage. So, let's see. I appreciate all of you who told me that the sound was okay. I really appreciate that. Oh, that's interesting. Melissa says, YouTube has been having a sound problem lately on other channels I've been on. Going out and coming back in works. So that is a solid tip if you're having a hard time with the audio on this video or perhaps on other videos. Maybe that'll be able to help you out. Let's see. Yeah, Raven pointed out that one of them talked about Medicaid workers going to work in the fields. That is something that we covered earlier in this stream. If you're interested in that, I do have the exact quote earlier in this video. You're welcome to rewind and see that. It was quite a thing. Okay. So if you don't qualify for disability, but you are disabled, I would assume, I can't promise this, but I would assume that as long as you have medical documentation to back that up, that even if the work requirements were to go into effect, it might be a tougher fight than if you were able to just be like, hey, I'm on disability, look at this, I'm fine. But if you've got medical records to show that, I wouldn't stress out too much because it should, I mean, there's got to be some sort of workaround for that, I would think. Okay. Oh, somebody said there's a bot in the comments. That's interesting. Okay, Rebecca says, if you're disabled, then you are not able-bodied. And that is very, very true. The only challenge with that is convincing the people at the Medicaid office that that's true, right? I have some people that I dearly love, relatives of mine who are extremely disabled, but have a very hard time getting the documentation to prove that because they're not Medicaid eligible and they can't work consistently enough to get healthcare coverage. So they don't go to the doctor. So they don't have medical records. So they have nothing to show the Social Security, administration. So they can't prove they're disabled. And it's just like this never ending death spiral. And so as long as you have documentation to back up the fact that you're disabled, you really should be fine. If you don't have disability and you want to try for it, we have a sponsor that can help you with that as well. If you go to lirlinks.com/claims, they can help you connect with a disability attorney that can help with that. Lisa says, if someone is disabled, do they have to do the recertification every 6 months? I believe so. I haven't seen any workaround saying that that would not be the case. That being said, the SNAP program, we have ESAP, which if you're not familiar with that, that's the Elderly Simplified Application Project. And what that does is if you're on disability or you have a fixed income, for SNAP benefits, you can go 2 to 3 years without a recertification because it just makes sense, right? Your income's not going to change. So it kind of cuts that paperwork down at the state level. I would not be surprised if we eventually see something like this come for Medicaid, where they extend it out for people who have long-term disabilities or are on fixed incomes, because honestly, it's going to be a lot for the states to keep up with, having to do everybody's recertifications every 6 months. They already have a hard time keeping up when it's just a year. So for now, to my understanding, and again, all these bills and changes are very, very new, so we haven't seen a lot of official documentation come out yet, but to my understanding, yes, you'll probably have to recertify every 6 months, but hopefully not forever. Let's see. Oh, wow, we did have a troll in the comments today. I am so sorry, guys. Let's see. Sorry, I'm trying to catch up on the chat. So some of these comments that you guys are asking, I feel bad highlighting on screen, and I don't necessarily want to click on them because I don't want to be, highlighting some of the medical challenges that you guys have here. As far as individual disabilities, there's not a lot I can do about personally determining whether or not you would remain eligible. I don't work with the state. I don't work for the government. I just research these programs. I would assume, do your best to keep good medical documentation. If you've got, whether that's a physical disability or a mental health disability or whatever that condition is, the more you can prove easily, the more resistant you are to any of these kinds of changes, right? It's just a good practice to keep that documentation because it can help you in a lot of different ways. So, let's see. Elle says, will there be arrests for non-compliance? Not that I saw. You'll just get booted, right? Like that's the whole point, is they're trying to get people off of Medicaid to save the government money, basically. This is a cost-saving measure. They weren't really shy about announcing that. So the idea is if you're not keeping up on the paperwork, if you're not keeping up with the requirements, they have a good excuse to remove you from the program. And once you're removed, it can be harder to get back on. And the more hoops they put there, the fewer people they have to pay for, I guess. I don't know. It's very stressful. Let's see. Dawn says, does any of this affect disability? I'm 63 and concerned. No, if you're disabled, you should be fine. All the work requirements I've ever seen exempt people on disability. So you should be okay. For those who are wondering if you missed what I said, you are totally welcome to go through and rewind. I will try to add chapters at the end of this so that you can jump through things easier. Let's see. I think I might be caught up. Am I caught up? Yeah, Kathy's asking if those over age 65 are in the clear. Yes, the highest age limit I saw was age 65. So if you're age 65 or older, you should be just fine. As far as the cuts to Section 8, I am still working on gathering that information. It hasn't been completely forthcoming, but I am going to work on getting that answer to you as soon as possible. This is one thing that I'm concerned about too, Mr. Donnie. There is so much time between applying for disability and actually getting it, right? I have a sister who's going through this process right now, and it is so tedious. And it's not uncommon to be denied over and over and over again while you're in pursuit of those benefits. I know for some things, if you can prove that you're actively working on it, that's sufficient. I can't guarantee that all states are going to necessarily honor that threshold. But if you have enough evidence to be pursuing disability, I would think that you've probably got enough to be able to at least make a convincing case that you should be exempt from these requirements. So hopefully, and I will be reaching out and asking these questions to the government as well and seeing if I can get some answers from you guys. Let's see. Oh, this is cool. Charlene is saying that, she received a letter from a hospital that she went in saying that the Medicaid is, or the hospital has forgiven the debt. There are a lot of debt forgiveness programs outside of Medicaid as well for those who are interested. I recently learned that hospitals that have a tax exempt status are actually required to offer some form of charity care. So if your income is low and you have to have treatment at a hospital for any reason, even if you're above the income limits for Medicaid, or for example, if you were to lose your Medicaid due to some of these work requirements or other things that are rolling out, definitely always ask about the hospital's financial assistance programs, because in a lot of cases, they will forgive the bill for people who make 200, 300, sometimes even 400% of the federal poverty level, which in simpler terms is 4 times the federal poverty level. So those income limits for those forgiveness programs can actually be extremely generous. Okay, yeah, so Jennifer's asking what was the name of the attorney that can help appeal for SSDI. So if you go to lirlinks.com/claim help, that will take you directly to the link where you take just like the quick little survey, and then they'll help connect you with somebody who can help you out. So let's see. Sorry, guys, I'm trying so hard to catch up on the chat. There's a lot more of you here, I think, than usual. This is interesting. Jamie, are you still here? I'm seeing that your husband received a paper from Medicaid saying that he's not qualified any longer. I don't do this very often, and if you want to email some additional information to team@lowincomerelief.com, I mean, this comment hits me hard. Those of you who are here regularly know that my little brother just passed away from MS recently. I would love to reach out to the state of Michigan and have a chat with them about this if you want to email me some additional information. If you email team@lowincomerelief.com, that goes to my assistant, Stephanie. She's the one who responds to a lot of comments here on the YouTube channel, and she'll make sure that I get that information so that we can follow up on that. Let's see. Yeah, so Rusty's saying in Iowa, they pretty much have to file every 6 months anyway. So some states are like that. It's going to be going everywhere now, which is, yeah, going to be difficult. So Elizabeth says every 6 months is going to be bad for everyone, especially ones where Medicare premiums are paid because you go inactive. That is a major concern. I don't know if you guys remember this. I do because of the research that I do. But shortly after they started ending all the pandemic protections for different things, they were forcing everyone to be recertified all at once. And there were just these huge backlogs where it could take 4 months or more to get those benefits sorted out. And going to every 6 months, honestly, kind of scares me a bit, because those backlogs are going to be increasingly likely. I think there are probably some plans to use some sort of automation to help speed that up, but that is definitely something to be aware of. When your 6-month thing comes up and it's time to recertify, I would really encourage everyone on here to not delay. Have your information together. Don't miss your interview appointments. Get that documentation in. Don't let any delay happen because of you. Try to be as proactive and involved as you can to try to minimize the impacts that could have on you. Because ultimately, when they end up with a backlog, it's not really the government that suffers, right? It's not the caseworker that's going to have to live with the consequences of that. It's the people who rely on those benefits who don't have them because of these backlogs. Those are the people who pay that price. And I don't want any of you to ever have to pay that price. That would be, not great. Let's see. So Josephine pointed out trade schools. You can actually, they're rolling out a workforce Pell Grant here soon that can cover a lot more different things. Oh my gosh. Okay. So I've been trying to figure out, there's like a side conversation happening in the chat here. If people think that I'm being rude because I sound happy and bubbly, I do apologize. I do try to be optimistic. I don't like coming on here with a doomsday tone of voice to you guys. I don't think that helps. Anyway, I've also heard from past videos when I am a little bit stressed out that you guys don't like that very much. So anyway, okay, on Medicaid, but must wait till October to go to dual plan. I don't think so. When I was talking to, through my partnership with Chapter, I get to talk to people who have a lot better expertise on Medicare than I do all the time. So you don't have to wait until October. In fact, I would encourage you not to, because everybody's trying to change in October, right? So if you're dual eligible, I would imagine you can probably get helped faster and get more of that personal attention if you don't wait, because then you're not just lost in the flood of everyone who's trying to make those changes all at once. Yeah, so Jamie, I saw your reply in here. I would definitely, email me whatever you've got, and then I'll see what we can do. I don't know how much we can do, but I do know that I have been very annoying to different press departments in the past, and sometimes we can get answers. So we'll see what we can do. Let's see. Sorry, I'm trying to read these as fast as I can, guys. Wow. Okay. So Anxiety Sauce, love that name, by the way, says, I'm retired due to chronic disability. I was new to Georgia and able to get SNAP, but they would not give me Medicaid, even with doctor medical documents of my condition. And I even had Medi-Cal in California. That is very concerning. This is one reason why for the last, I don't know, month, 2 months, maybe 6 months, I'm kind of losing track of time with how many updates are rolling out so fast. But this is one reason why I've been saying a lot lately that if you are eligible for any sort of official disability program, whether that's Social Security disability, VA disability, whatever it is, if you have the documentation to try to get one of those programs, please do it, because it's so much easier to prove disability if you're on one of those programs than if you're just bringing in that documentation. If you have nothing else, I'm hoping that documentation will work for you. In a lot of cases, I've heard that it does, but clearly Anxiety Sauce had a different experience. Try to get on the official disability programs if you can. I know it takes forever, but really, it's such an important thing. Oh, thank you, MJ. I really appreciate this. This is my goal right here to, I spent 6 hours researching this stuff this morning and reading through all these documents and trying to assemble these slides and get all this stuff together for you. But that's what I love to do. I love to try to help and, explain that information in a way that's accessible, because they don't make it easy to understand any of this stuff. Okay, Stephanie's asking, if I get SSI, will I need to recertify? I think so. I didn't see anything saying that you wouldn't have to, but again, I'll keep watching to see if there's any sort of clarification on that over time. That recertification rule came out as part of the One Big Beautiful Bill Act legislation. And so it's still very new. And I think a lot of the finer points of how it's going to work still have yet to be revealed. So, yeah. Let's see. Yeah, this right here is a big point. Many individuals on Medicaid have serious health issues and can't work if they wanted to. And that is exactly it. I saw that comment from the agriculture secretary saying, oh, well, we've got 34 million able-bodied people on Medicaid. But I know in that number, they're counting people like my loved one who is too disabled to work, but doesn't have the documentation required to get disability. And if they're banking on those people entering the workforce, I mean, it's not realistic, right? Anyway, I could preach on that for days. It really bothers me. Let's see. Oh, which URL did you want, Wendy? I'm sorry, I said a lot of them. I do apologize. I can type it out in the chat if you pop in again and tell me which one you were after. Ouch. Ing points out sometimes Medicare takes 2 years after you apply for disability. And yeah, it is not a quick process by any stretch of the imagination, but it's better late than never, right? Yeah. Okay, here's some good advice from Josephine. If you're denied food stamp appeal, okay, if you're denied food stamps appeal, I was denied, I appealed, and they approved me without talking to anyone. This is huge. Whenever you're denied for anything, whether that's going to be Medicaid or SSDI or food stamps or whatever it is, those big, long packets of paper that they send you in that decision are supposed to tell you at least how to file that appeal. And there's usually a deadline on it. You usually have to act within 30, 60, 90 days, whatever it is. always file that appeal. It's so important. One of the benefits of appealing with a lot of these programs is your effective date will stay the same from your original application, which means even if it took them 6 months to deny you and then you appealed and then it took another year or whatever, you're going to be entitled to that back pay for that time that you were waiting. If it's something like SSDI, I know that doesn't necessarily work with the other ones, but yeah, definitely always appeal. Appeal always. This is good advice too. Check to see if it's a scam letter. If you, I think this is specifically in reference to the denial letter that we were talking about earlier. There is a shocking amount of scammers out there that will send you copycat letters that look super official. I had a tax debt a couple of years ago and I got tricked, even though I report on this stuff all the time and I absolutely should have known better. I got tricked, I think 3 separate times calling a hotline that wasn't the official state line, because the letters looked so convincing. So please be careful whenever you receive a letter and make sure that it's not a scam letter. Let's see. All right, Lisa's asking, how would it work if you get Medicare and Medicaid? If you're on Medicare, more than likely you're going to be exempt from all of the work requirements. You should be totally fine. But again, if you're dual eligible, call chapter because they can advise you a lot better. Let's see. Victoria points out you can be disabled and not qualify for Medicaid due to income limits, and that's absolutely true. Victoria, I love this comment about not being obsessed with other people's situations. That's kind of a guiding principle here at Low Income Relief. I try not to, I've been through a lot of things in my life. I know a lot of people who have been through a lot of things. This is a judgment-free channel as far as I'm concerned. And if I knew how to hit people with the ban hammer here in this tool that I'm using, I would absolutely be doing that in the chat. But I haven't quite figured that out yet because this tool is new to me. But at the end of this, I am absolutely going to figure out how to do that because I'm sorry for what you guys have had to be putting up with in the chat today. All right, I think we've already answered this one, but just in case, I'm going to hit it again. Rusty saying, if I'm disabled, will I need to refile every 6 months? It looks like it right now, but I would not be surprised if those rules changed. I don't see why they would need you to do that, but yeah, they haven't made that clear yet. Let's see. Yeah, so Brian is saying, oh yeah, that is what I'm saying. If you're disabled or have a disability, you don't necessarily, for the Medicaid exemptions, a lot of them specifically exempt people who have Social Security disability. So if you can get that, by all means get that. If you can't get that, whether that's you don't have enough work credits or you don't meet their strict requirements or whatever, and you're still too disabled to work, I would say keep your medical records and use them when the Medicaid office is pushing those changes. In most areas, that shouldn't be something you have to worry about necessarily today, but those changes are coming. They're coming very quickly, as we went over earlier. But keeping those medical records for yourself so that when the issue does come up and you can be like, hey, I'm disabled, here's my evidence, that helps tremendously to have that together. I think I missed a joke about turtles in here. I do apologize. Okay, so Frank is saying, what if someone has a 5-year-old kid? A lot of the work requirements make exemptions for people who have children under the age of 6 if they are the primary caregiver for that child. So hopefully, at 5 years old, that shouldn't necessarily be an issue. But as soon as they hit school age, I think the expectation is that they'll be in school. And so those work requirements then go into effect, it seems like. Sorry about the rude people in the chat today, guys. I am so sorry. Okay, so here, Facts in 60 Seconds is asking about ACA. I actually have a bunch of notes put together, and I am preparing to do a live stream on our second channel, which is called Fast Facts by Low Income Relief, where we'll be going over all of the changes that are going to affect people who bought from the ACA. Most of the people I think who watch this main channel are either on Medicaid or Medicare, so I didn't want to go over that here. But on our second channel, where I cover a lot of different topics, I will be doing that video soon. So make sure you go check out that other channel. What agency is requiring recertification every 6 months? The One Big Beautiful Bill Act requires that people who receive Medicaid recertify every 6 months. So it will be a federal Medicaid requirement that you recertify every 6 months, and that is supposed to go into effect 180 days after the bill was signed, which was July 4th, which by my calculation means that that 6-month requirement will trigger January 1st of 2026. So yeah, that's, here we go. Yeah. Yeah, I'm sorry that the situation is so stressful, guys. I really hate bringing you bad news. I much prefer videos like the one we did yesterday where I was telling you guys how to get like free school supplies, or the one we did a couple weeks back about how to get a free car. Those are the videos I like to make for you. I do not like making the sad videos, but it's important to be informed, right? As much as I hate coming on here and giving you guys all the bad news, I'd rather you have it and know what's going on and what you can do about it than have you be blindsided by this out of the blue. You know, that's just a terrible thing. So yeah, so here we are. Let's see. James says, and don't answer any calls from unknown numbers. That is a great tip. More often than not, I don't even answer my phone for known numbers. I figure people can leave me a voicemail. But anyway, that's just, I hate talking on the phone. That's just for me. Okay, Wendy is saying that she's desperate for a new computer. So I just want to jump in and say, go check out our other video about how to get a free computer, because there are nonprofits and organizations out there that offer free laptops, desktops, tablets, that sort of thing. We did a whole video on it, and if you're eligible, that can be a total game changer. So highly recommend checking that out. Let's see. I love how so many people think that it's just easy to work those 20 hours a week if you're, you know, disabled or anyway. Sorry that there's so many of those comments in here today. So as far as questions about specific Medicare plans, that is above my pay grade. I can't address those. I don't, that's where I refer to Chapter. And it's why I'm so grateful to have a partnership with Chapter, actually. It wasn't until I started talking to them that I learned that there are over 20,000 Medicare plans nationwide, which makes it so easy to understand why it's so complicated, because there's just so many of them out there. But luckily, they have the tools to go through all of them, figure out what's available in your area, which ones will cover your doctors, your prescriptions, and the things that you need, and get you the best perks and all of that. So if I sound like I'm shilling for Chapter, it's just because I absolutely love what they do. I mean, they do sponsor us, which I also appreciate, but you guys know me. I refer people to things that I genuinely believe in, and I genuinely love that service. So Section 8 questions, I'm going to defer to another video. I am working on a stream about that. You guys might have noticed I've been trying to hop on here every day this week at around this time to have these important conversations with you guys. So got lots of videos coming up. And we'll get to LIHEAP as well, because there's still a lot of questions about how that is going to work. And I'm waiting on a response to an email that I sent to the government a while back. So as soon as I get more clarification on that, we'll be hopping on to talk about that as well. Okay, Kinga Kong says, what is our other channel? So the other channel that you will want to follow, here, I'll type it up in the chat. It's called Fast Facts by Low Income Relief. Maybe I can grab the link really quick. Sorry about that, guys. So like I said earlier in the stream, oh, why is it talking out of my computer? Okay. Sorry about that. I am testing a new streaming tool today, and it may or may not cut me off in 5 minutes, depending on whether or not I'm allowed to stream for more than an hour. If it does cut me off, just know that I really love and appreciate all of you guys. And hopefully it doesn't cut me off so that I can answer more of your questions, but we'll see what we can do there. Okay, Francis says, please let me know about the computers. So yeah, so we have another video about that. I think it's on this channel. Let me see if I can grab that really quick. All right, yeah, I'll just grab that link really quick and then drop that there too. If you guys are watching the chat, hopefully you can see the ones that I'm typing into this tool. I'm kind of new at this particular thing. Okay, there we go. Okay. So it's the problem with recertifying every 6 months isn't about people doing something shady or hiding things or anything like that. The problem with recertifying every 6 months is, number one, state governments are busy. They have a hard time keeping up on the amount of paperwork they're already processing, and this is going to double their recertification workload, right? So we're talking about just inherent delays unless they're going to hire more people, but they've been laying people off, so that wouldn't track, right? So there's potential delays there. The other problem with recertifying every 6 months is it's just a red tape thing. It's designed to trip people up, not because they're doing something shady or because there's any reason they don't qualify, but just because if you are meeting those work requirements and you have to do a phone interview or you're going to lose your benefits, we've seen issues in states where people aren't notified until they get their notification letter after their scheduled appointment would have been. And so they missed the appointment and then they tripped up and they lost their benefits, right? So we've already seen that happening just with annual recertifications. It's going to be worse if it has to happen every 6 months. People are going to have to meet the hourly requirements, but also possibly take time off work to do interviews. But then you can just see how this just gets so much more complicated. It's not about doing anything shady. It's just about the reality of you're trying to live your life. You're trying to do the right things. And it's just more red tape and hoops you have to jump through to be able to get the help that you need. That's the issue with the 6 month recertification, at least in my opinion. Let's see. I know there's a lot of people that are upset on YouTube about a lot of things right now. I'm seeing a lot of comments about different programs and different things. There's a lot of stress out there. There's a lot of unknowns. It is a scary time to be reliant on any of this stuff. And you guys know I don't like bringing you bad news, but in the course of my research today, I saw all sorts of talks about how this fall they're going to bring another big omnibus bill to Congress to try to make even more changes that were left out of the last one because, like I explained in our previous video, there's a lot of things that they weren't allowed to do in the One Big Beautiful Bill Act because it was a budget reconciliation bill. And those particular types of legislation, they only need a very bare majority, right? So they need like 51 votes to be able to pass that, just very thin margins. But because of that special rule type, they also couldn't enact a lot of the changes that they wanted to change. And so there is already talk that in a couple of months from now, we're going to be right back in the thick of this with another big bill talking about even more changes. So I don't want to hypothesize about what's going to be in those until we start seeing some copy for that. But it's, there's just things are changing crazy fast. And that's one of the reasons why we decided to start doing more videos here on low income relief, because the 3 videos a week we've been doing historically just aren't cutting it with all of the changes that are coming out and the rapid pace at which things are going on. Oh, I really appreciate this. Lady Jane says, I didn't create the bad news. I'm just delivering the information. Thank you. That means a lot because I know it's not my fault, but I still hate being the bearer of bad news. And sometimes we do I do feel like I'm attacked for being the messenger. So appreciate your kindness very, very much. Let's see. Okay. No, disabled people should not have to work. The only exception to that might be if you are unable to convince the office that you're disabled, right? Like I said before, if you're on a disability program, you should be fine. If you are too disabled to work, but you're not, if you haven't already proven that disability to, say, the VA, the Social Security Administration, some other form of program, then you may have a lot more hoops to jump through and a lot more things that you need to worry about. Yeah, let's see. I have not done a video on getting a Miller's Trust, but I will make a note of that and I will go look into that because that is a great tip. I always appreciate your tips, by the way. If you know something that we haven't covered, or if there's something you'd like us to cover more of, or any of that, you're always welcome to email us at tips@lowincomerelief.com. That email goes to my assistant, Stephanie, and then she can forward that on to me. And yeah, that's a great way to help us get more information out to people and to help other people as well. So. And it just rolled over the 1 hour mark. So clearly I don't have that limitation on my streaming service. So now we know. Let's see. Wow, I still have so much more chat to go through. You guys are so chatty today and I love it. It's a lot more fun to be on here when you're all on here with me. Is there an upper age limit for work requirements? So yes, the federal government has said that upper age limit is going to be 65. However, the state-specific waivers that we went through earlier in this stream, back when I was still on my slides, some states set that limit as low as 62. Some said 64. So just in that range is where that limit is. Yeah. Let's see. This is a great question. If you retire at 62, will you be required to go back to work until 64? I don't think so, but I honestly don't know. That is something that I can reach out to the press department and see if I can get some good answers on that, because that is also a question that I thought of earlier, because, that is a very valid concern. I would think if you're getting some form of retirement benefits, because their goal is that they want people having income, right? So I would think if you're getting some form of retirement benefits that you should be exempt from that. But again, I am not 100% certain that that is the correct answer. So let's see. I really appreciate all of you guys. You guys give me the most supportive comments in here. Brenda's asking if I know anything about universal basic income. That was a big conversation, especially during the pandemic years. We heard a lot about basic income. We heard a lot about guaranteed income programs. Most of the guaranteed income programs that were being offered have ended, dried up, been canceled, sometimes been legally challenged to the point where they couldn't continue. I don't think the current administration has any interest in doing any form of basic income. We're seeing a lot of things being stripped down, but that is something that I am always watching for. And if I find anything on that, you better believe I will be on here on a video right away to tell you all about it. Let's see. Okay. Tammy says, my husband and I are caregivers to a handicapped adult in our home. Will we be exempt from work requirements? In a lot of areas, they have specified that if you are taking care of a disabled person in your home, then you will be exempt. So I would think that the answer is yes. Now, sometimes they do use the language that is, if you're the primary caregiver to, which in that case, they may try to limit it to either your husband or you, or just one of you, just because of the use of the word primary caregiver. I could see that becoming a technicality that they could get hung up on. But again, it would depend on what state you're in, what exemptions they've decided to roll out, and all of that. So, yeah. Let's see. Holly says it's like they make it deliberately tedious so that we can't have it. This is strictly my personal opinion. This is not the opinion of any of my sponsors or, not even necessarily low income relief as a whole. But yeah, I think so. I really feel like a lot of the programs that are out there are shrouded in red tape, because the harder it is to get, the less liability they have to pay things out. And in the One Big Beautiful Bill Act, 2 of the changes they made were specifically to defer rules that were intended to make benefits easier to get in use, specifically Medicaid. There was a rule, I forget what the first one was. No. Okay, so one of them was, I think, supposed to help if you were dual eligible for both Medicare and Medicaid. And I think the other one was to help if you like lost Medicaid eligibility, but you had to move to like CHIP or one of the other healthcare programs. Either way, there were two rules in there that were supposed to streamline things, make it easier to get and access these programs. And they postponed them, I think, to 2034, just to make it more difficult to use. I would assume that would be the motivation anyway. So anyway, Wendy says, remember ABLE accounts too. ABLE accounts are great. They are going to be expanding the eligibility for ABLE accounts soon too, if I recall. But yes, if you're disabled and you're able to get an ABLE account, those are fantastic. Love Sings says that you're spreading the word. I really appreciate that. You have no idea how much that means to me to have you guys sharing and helping to spread the word about this channel. You know, for a long time, if you guys know, I'm always honest with you. I'm perhaps maybe not always this blunt, but for a long time, low income relief was able to fully be my full-time job. And I got to do this sort of research all day long to try to help you guys. And I feel like we were a lot more helpful in those years. In recent years with some of the AI rollouts and different things, we've had other people stealing our content and doing different stuff. And I've had to take on other work outside of low income relief. And that's been hard because I don't get to spend as much time researching for you guys. But the more that you share and help get the word out, the more time I get to spend just focused on finding the resources for you guys. And I really appreciate that. Okay. Jumping back in to try to read some more. Oh, Holly, I'm so sorry. I worry about you guys all of the time. I know that so many of you are talking about having anxiety or worries or struggles with all of this, and I can't blame you in the least degree because, I mean, this is scary stuff, and it's unpredictable. And I don't know about you guys, but the way that my anxiety works, unpredictability is the worst form of like anything, because even if it's bad, if I know what's going to happen, then at least I can brace for it. But if it's unpredictable, that's just the worst. And I am so sorry. I wish there was better news out there for you guys. I'm actually working on launching another YouTube channel because, you know, the 14 I already have aren't enough. But I'm working on launching another brand. They're going to call it Hope, and it's going to be focused on, like, obviously I'm not a therapist, so it's not going to be like, you know, straight up mental health stuff, but we're going to do a lot of, you know, like meditations and mindfulness techniques and things that have helped me in my recovery from having anxiety. And so that's going to be something that we're going to be rolling out in a couple of weeks, and we'll post about it here when that goes live, because we'll have all sorts of like journals and different tools and things. But it's something we're working on in all of that spare time that, you know, the team and I have. We don't have spare time, but we try. So Raylene says, I wonder how this will affect your veterans with 100% disabilities. So if you have 100% disability rating from the VA, I don't imagine any work requirements are going to be able to touch you in any state. You should also be able to get healthcare from the VA. That being said, I know that's not ideal. I have plenty of veterans in my life who choose not to get healthcare from the VA because of the quality of care that they've received in the past. I think there's, you know, logically, I can't say that this is how they're going to do things, but logically, it would make sense to me that if you're rated permanent and totally disabled from the VA, that they probably wouldn't hold you to those 6-month recertifications. That being said, I haven't seen anything indicating that that is actually the case, so don't quote me on that. That's just my personal thoughts and beliefs on the thing. It wouldn't make sense to me otherwise. But then again, I mean, it wouldn't be the first time that government chose to do something that didn't make sense to me either. So there you go. Let's see. Okay. Holly says, I think I missed the video with the updates about food stamps. So you probably did. We did a huge overview video is the way that I did it, which, you know, may not have been the best approach in hindsight. It would have been from last week, probably on the 4th or the 5th, but we just recapped. I think it was something like when the changes are going to take effect. And we just went through all of the deadlines that were in that legislation. So I'll see if I can get somebody to grab that link and drop it for you. And yeah. Trying to catch up on the chat. I do have a deadline and I have to get off of here soon, but I know I haven't caught up and I don't like leaving any of you hanging. Okay, so as far as ABLE accounts, I haven't seen any indication that they're going to be cut. A number of, you know what, here, just let me look really quick. They were going to increase the age limit for it at one point. Yeah, so January 1st of 2026 is when the ABLE accounts are supposed to change. And they're going to increase the age limit from 26 to 46, which will make so many more people eligible to be able to use those, which is the thing that I was excited about. And that change was not anything that was the change was not anything that was recently announced. That was announced ages and ages ago. It just had a future date, and I've been waiting down for that change to take effect. So sorry guys, I'm gonna try to grab that video link while I'm over here doing stuff, as long as this doesn't make any noise at me. Okay. I do so appreciate all of you guys and your patience with me. Okay, yeah, here's that video link, and I'll just grab this and hold it real quick. Sorry, I need to get better at multitasking while I'm here live with you guys. Okay. I am going to try not to get back into the discussion about what Brooke Rollins said. I know that it was horrible, and we addressed it in the slides earlier in this video, like an hour ago. I can't believe we're still going. But yeah, you can scroll back and see that I have her exact quote in there early on if you want to see exactly what was said. It was pretty special. So Holly's asking, is Medicaid the one that covers your dental bills, or is that Medicare? It depends on which plan you have and where you live. In some states, Medicaid will cover dental, in others it won't. Some Medicare Advantage plans have limited dental coverage, others don't. It really just depends. Let's see. Oh, thank you, Gloria. I really appreciate you. I really appreciate all of you. I think I'm almost caught up on the chat, which is impressive because I didn't think I was actually going to succeed in catching up with you guys. Yeah, so Elizabeth says you can apply for Medicare and Medicaid dual plans as long as your Medicaid is active. If you're currently inactive with Medicaid, you'll have to wait until you're active again. So as long as you have both of those things, you should be good to go. And you should be able to switch between plans as well. And that's something that our sponsor chapter can help with at the number that you see on screen there if you're interested in that. I try not to push things on you, but I'm really excited about this one because they don't charge you anything, right? Like you don't have to pay anything and they can help you so much. So big fan of those kinds of arrangements. Let's see. Alrighty, wow, it looks like either my tool broke or I hit the end of the chat. Hopefully it's that I caught up with you guys and not that I'm missing anybody, because I hate leaving when I think that any of you may have had a question or something that I've been unable to answer. So just as we wrap up here, just to see if anybody has anything else they want to say before I go. I am trying very hard to get videos out to you more often. Our previous plan of doing 3 videos a week, I just don't think was cutting it in terms of getting out all the information about the changes that were happening and the other resources that we know about. So I would love to know from you what the best time is for you to catch a live stream, just so that I know that I'm getting the videos out at a time that's most useful to you. And then, of course, always, if you have any specific questions you'd like us to address or tips that you'd like us to cover, resources that you would like to share with the community, please just let us know. We'd love to help get that information out to as many people as possible because, you know, we're here to help. That's what we want to do. That's what we're passionate about doing. So, let's see. Okay. Alrighty. With that in mind, we've been here for over an hour today, and I appreciate you staying with me. I'm going to go ahead and wrap up for today. Oh, wait, no, sorry. I just saw one more thing come in that I'm going to answer really quick. I do apologize. Does low income relief have newsletters or anything? Oh, do we ever? So yes, we do have newsletters. So I'll type this up here really quick. There's two ways that you can sign up. So we have one that is just going to put you on our newsletter, or if you want that free Medicare book, you can get on the newsletter by signing up for the book as well. And either one of those will put you on our email list. It's just if you sign up with the link that's for the free Medicare book, then you also get that book download and a couple of emails from that special sequence as well that are specifically for Medicaid. But yeah, we have newsletters. We have a second channel. We have a website. Love the website. I started Low Income Relief because I wanted to do, I was a journalist, right? So I just started writing content for our own website. And then sure enough, I ended up here on YouTube, and it's been a hard transition, but I appreciate that you guys are so patient with me, because usually I just, prefer to sit behind my screen and not, socialize much. But this has been an awesome experience, being able to do this with you. So, all right, with that in mind, I'm going to go ahead and sign off for today. Please know how much I appreciate you. You guys are wonderful. I appreciate all of you who have been here with me in the chat, who stuck with me through this video. I think you're all fantastic. And I will be back hopefully tomorrow with more news and resources to help you out.